service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care Inc. at 954-717-7027. License 200999096.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life radio show for Tuesday, March 24th, 2020. For tonight's radio show, we have some great information coming your way on telehealth and a report we're going to share with you if we have some time at the end on vitamin D consumption to possibly boost your immune system from the former CDC director, Tom Frieden. But like I said, we're going to start with telehealth. We have Aneel Irfan. He's CTC and CTH are his medical credentials. Actually, his credentials, he's president and CEO of IMST Incorporated and Virtual Health Strategies. They are a consulting firm based in West Palm Beach. They focus on assisting healthcare providers in developing sustainable virtual care programs such as telemedicine, which you've heard us talk a little bit about on this show. You know, our sponsor is involved in telemedicine, All County Healthcare, and also in remote patient monitoring. Aneel is a Florida Telehealth Group member and helped our legislators develop telemedicine rules and regulations. He has been the contributing editor of Telemedicine Magazine, former fellow writer, I should say, and editor, guest lecturer at Nova Southeastern University, and a certified telehealth professional from the National School of Applied Health. So without further ado, I'll welcome Aneel Irfan. I hope I'm saying that right. Aneel, how are you doing this evening?
I'm doing well. Really overwhelmed. It's just a crazy time, a crazy world. I just want to start off by saying, shout out to all our frontline healthcare workers and people that are putting their lives on the line in this, kind of trying time. But thank you for having me. I'm glad we finally sit down and make this happen.
Now, that's great. In the 5+ years you've been a CEO, your focus from medical supply and brand name non-RX medical supplies has evolved. I mean, there's a lot that has changed in just the medical landscape in the last 5 years, so I'm sure that's changed as well. Can you tell us about your company, IMST Innovations, the evolution of your company from the start and your focuses today?
Oh, yeah, absolutely. So, I'll be honest, when I started the company, I was a real naive entrepreneur, I'll be honest, and my journey, especially around telehealth specifically, has really been a roller coaster, which, many times entrepreneurship is, right?
Definitely.
I came into the space very fascinated with the technology. It made sense to me. Everything is going online. We shop online. We communicate online. I said one day we're going to be, accessing healthcare online. So to me, it was a no-brainer. I said, with my sales background, I think I could sell anything. And what I quickly learned was, though the technology existed, the rules, the regulations, the laws, it didn't exist. And so initially, the first early on of the company, we were very much focused on advocating and the use and the adoption of telehealth with legislators and lawmakers. So I never thought I would be in Tallahassee advocating for the use of some technology, but it was so essential to my business and it was so early that was the important task at hand. Okay. Solely when those legislative barriers fell, I also quickly realized that the technology is just one small piece. That I can offer technology, but if we don't have an understanding or a plan of how to implement it around workflows and training, then the technology just doesn't get used. So then I morphed into this consultant-focused role and company where we offered the technology. We worked with various different vendors, but we focused more on the program development, the education, the training, and we were able to be very successful there in implementing small and large programs. And as the industry evolved and continued to grow, I've focused on getting the message out and being an advocate of not only large institutions utilizing telehealth, but also underserved, federally qualified healthcare centers and focus locally on the community. So it's been a whirlwind, especially to where we are now, where I truly believe we're at a tipping point. And we can talk a little bit further about that, about because of this pandemic, how we're seeing the virtual medicine space really at a tipping point and going full blown at this point.
Yeah, and I wanted to mention also, so yourself and I, we actually met virtually. I share my show on a lot of platforms, and we kind of connected on LinkedIn and been talking for a long time. So I definitely wanted to have you on, but that's interesting. That's the way we connected, and that's the way a lot of health is going on nowadays. So that is really neat to kind of put things full circle.
Right, and one thing I'll say, David, is I got to the telehealth community. Though it's a small community, there's passionate folks in that community. There's resource centers that I got very close to early on in my career. They're federally funded telehealth resource centers. They're geographically placed across the country, and their sole job is to push adoption for telehealth in their region. So for our region, it's the Southeastern Telehealth Resource Center. I was thirsty to learn the space and be involved on all the movements, and they were the pulse of telehealth adoption in those regions. And so, but a lot of that connection, a lot of the initial awareness and promotion of myself as a thought leader in the space is through LinkedIn and online platforms. So it's good. We did connect online, and it's great how we can bring the world together using technology.
I'm going to skip around a bit. I mean, we only have so much time, but so one of the interesting things I saw, so you're a pretty much a telehealth consultant. Am I correct in saying that? I missed a little at the beginning. I was sharing it on.
Sure, telehealth consultant, telehealth advocate. I'm a writer. Yes.
Yeah, and the magazine, that's great too. I want to ask you about that as well. But one of the interesting things that when I was reading your bio is the rules and regulations for telehealth. You worked with legislators on this. Was that in the state of Florida or nationally? Could you tell us a little bit about that? Because that's really interesting, because we all think, all these healthcare organizations are jumping on telehealth, and some of them have been doing pretty well for a little while now, and others are jumping back on board. But yeah, there's rules and regulations, etc.
Well, yes. And one of the things the magazine afforded me to do was to travel the country and visit and speak with states that were already ahead in regards to legislation and rules and medical board rules and regulations. So when we come to Florida, where we were so behind, I was able to work with ACA when the governor, I think it was Rick Scott at the time, he established a telehealth advisory council that ACA was managing. And at that time, one of the things that they had to do was survey every licensed provider and facility in the state to understand, hey, what are the pockets of telehealth? What are the barriers? And one of the things I'm very proud to say was I was able to work with ACA to actually develop those surveys and the questions in those surveys. And I'm still close to this day to many folks that were on that advisory council. A lot of work was done to get us to this point. We're still not there 100%. These recent legislations have emergency rules have expanded things dramatically. But, so it was a lot of work in Florida, just getting reimbursement, even defining telehealth in our state. So we've done a lot of great work. Our Florida work groups and also our telehealth resource centers can be a credit to that. It wasn't just me. So a lot of stakeholders, passionate stakeholders around the state, really push for certain things for provider rights and just the use of telehealth, not restricting its use.
So we got about a minute before the commercial break coming up here. I just want to ask you, so anyone interested in, providers or businesses interested in your telehealth consulting, they can just reach out to you, I guess, by phone is best. I think I have your cell if you want me to give that out, or you can go ahead and give out any info you'd like.
Yeah, sure, absolutely. We're on, my cell phone directly is 954-774-4138. You can always reach out to me with any telehealth or telemedicine questions. Also, you can check out our Facebook page. It's Aneel Irfan Virtual Health Strategies on Facebook. Very active on Instagram, Aneel Irfan Virtual Health. I am an open book in regards to telehealth knowledge and telemedicine information. So please free to use me. I'd like to be an asset to our community providers.
Yeah, and then a little bit of background. You're a guest lecturer at Nova Southeastern University. You're a certified telehealth professional from the National School of Applied Telehealth. So you definitely have the credentials. So it's Aneel Irfan. Did I get that right? I missed that at the beginning.
Aneel Irfan. It's good.
Again, it's 954-774-4138. And I'm going to take a quick break and be right back on the Living a Longer and Healthier Life show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470. All County Healthcare has exciting news for any and all patients with COPD. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the Living a Longer and Healthier Life show. We have on the phone, I'm going to introduce him here in a second. You know him, Lou Biasi, Vice President of All County Healthcare. I do want to read something and then Lou can comment on, that's coming directly from All County Healthcare right off the presses today. Notice to physicians in Miami-Dade, Broward, and Palm Beach counties. For over 25 years, All County Healthcare Incorporated, a locally owned and operated Medicare-certified ACHC-accredited home health agency, has been serving residents of the Tri-County area. We stand ready to assist you during the current coronavirus COVID-19 pandemic. If due to the current crisis your office has closed or is working with reduced work hours and you have patients whom you need assessed, All County Healthcare can send a registered nurse to evaluate you and or treat your patients. We will require a home care referral. The patients must be homebound, and you must have seen the patient in your office or through telehealth encounter within the last 90 days. Our nurses will visit the patients in their home and report the assessment to you. This service will expedite patient care, help prevent the spread of the virus, and provide critical care that your patients may require during this difficult time. Please call All County Healthcare at 954-717-7027 or fax your referral and home care orders to 954-717-7018 to make use of this valuable service. If you have any questions, again, call them at 954-717-7027. And they do have a toll-free 1-888-717-7170. A lot of info there, but you can go to allcountyhealthcare.com and grab all those numbers. So without further ado, Lou, welcome back to the program. How are you doing this evening?
I'm fine, thank you. I'm listening to your telehealth man.
Pretty good. Consultant, right?
Yes, he's still on the phone?
No, we dropped him to bring you on, but I'm going to get you two connected.
Okay, I have a question. You know, telehealth is a fantastic thing. All County affiliated itself with a company called American Telemedicine. They're doing the telehealth now with remote patient monitoring, where the physician basically could put a patient on a telehealth program, monitor him, remote patient monitoring. He's allowed to get paid for this, to X amount of dollars. It doesn't cost the patient any money. If the patient has multiple diagnosis or a few diagnoses that he's worried about, the doctor can monitor him we're monitoring 24/7, and the doctor gets a report in his EMR machine. So telehealth has come a long way, and with this coronavirus thing, it's amazing how many people right now are using telehealth just by phone to phone. So the question is, a lot of the physicians are working with these patients on a telehealth call, and Medicare has released some of its guidelines so these doctors can get paid for this telehealth visit. Along with that, I mean, that's fantastic. But again, if they use the live care system, which we're representing, American Telemedicine represents it, we can go to any physician. A physician can sign up any one of its patients who have multiple symptoms, and they basically want to monitor them. They can monitor them on a monthly basis, and then Medicare will reimburse them. So, you know, as the gentleman is saying, telehealth has come a long way. And we're coming up with a new product. The new product that will be coming, the patients can have it directly, and it's basically like a hospital at home with them. So it's amazing what's happening with the telehealth system right now. As you can see throughout the country, doctors are using the telehealth. I just talked to a doctor yesterday. I said, Doc, how are you contacting your patients? He said, I'm using telehealth. I'm calling them on my cell phone. Well, sometimes that cell phone wasn't FDA approved or it wasn't even certified to do it. But now I guess they're lessening some of the criteria that they can use the cell phones. So ours is all FDA approved, all Medicare approved, Medicare allowable, and it's the most amazing system. So if any of the people out there are listening and they want to become a part of our program, ask your doctor to join the live care monitoring program where we can monitor their conditions. By that, it's like the gentleman said, we take their blood pressure daily, their oxygen levels daily, also get their temperature. They can also get their weight checked. They get glucometer if they got diabetes. We have a heart patch if they have heart problems. So basically, everything can be done for that patient. It goes into our monitoring station, which is transferred into the doctor's EMR station, so EMR network. So they're looking at this thing, and the doctor's looking at it. The patient now has superseded what the doctor said is his criteria or his protocols. The doctor is notified, the patient is notified. If the patient has to be 911, then he's 911, or the doctor brings him into his office. What's happening today with the coronavirus thing, as I said, most of the doctors don't want to see that many patients in their office, and the hospitals don't want to see any patients unless it's a real emergency. So, you know, it's nice to know as an individual. I'm on the system myself. I've just taken my blood pressure. I just taken my oximeter. It's gone into our monitoring station, into our live care system. That will go to my doctor tomorrow. My doctor will review that, and hopefully at the end of the month, he'll review all my vital signs, and they'll see that if everything's normal, he'll tell me it's normal. If he thinks something's abnormal, he'll call me in for a visit or during the week. So it's just amazing, David, what's happening. If any listeners or individuals have any questions, they can call American Telemedicine, and that's at 278-561-278-2222. That's 561-278-2222. That's American Telemedicine that's working with All County Healthcare to get this thing out to doctors and out to individuals.
So is this this is available for anyone in the South Florida area, I presume?
Anyone in the South Florida area that's a Medicare patient, Medicare now will pay the doctors to monitor the patient. If not, if the patients wanted alone, for instance, it's a dual purpose. If the patients are living alone and can't afford a home health aide, let's say they need assistance with ADLs, and a home health aide is only there 4 to 5 hours a day, or 6 hours a day, or 8 hours a day, they can basically take this system, install it in their own home, because they can connect themselves to the home health care company. We're still monitoring them 24/7, and if it's an emergency, we will notify them or notify their doctor or notify a family member. This also has on it, for their own sake, a medication reminder to take your medication, to take your whatever medication you take. If in the middle of the night you're not feeling well, you call our monitoring station, talk to one of our nurses or physicians who was ever on duty there, and they will ask you some certain questions to see what's going on with your whole problem. So that's at 11 cents an hour. So
now, is there any cost to start? Like if someone wants to get enrolled, I mean, is it going to cost them? I mean, everyone's kind of watching their finances right now.
It's $65 a month.
Okay, and you said say it again, 11 cents.
If you take $65 a month, if you take the number of hours in a month, it comes to 11 cents an hour.
Unbelievable. It's definitely affordable,
so
right?
You have something that's sitting there with you. Your home health aid is going to cost you anywhere from $16, $18 to $20 an hour, right? And some of the patients can't afford that, but they'll have this system by their bedside, or they can have it on their neck. They can wear it as a necklace if they leave the house. It has a GPS system on it. It also has a fall detection on it. If they're going to fall, the system will notify them, and it's visual. They can use the system. They can see the patient. The doctor can see them. They can see their children for the system. The children can call into the system, say the mother falls, right? For instance, you just got to press the button. The daughter can call the mother. The mother sees her where she is, where she's lying on the floor. So the system is just amazing. And all they have to do is call American Telemedicine at 561-278-2222, and we will give them a whole in-service. We will give the family a whole in-service on how this product works. It's not just something, this does everything. I'm not knocking, if they have a system now, like a system with a watch or a pendant, like mobile health, that, when you fall, you press the button, they send 911, they take you right to the hospital. Well, this avoids a lot of taking to the hospitals if you don't have to be taken, because you can talk to one of our people.
Lou, that's great info. I want to, we're out of time. Okay. Again, the number's 561-278-2222. If you have any questions, Lou, thank you. I also want to thank Aneel Irfan as well from IMST Incorporated Virtual Health Strategies. Look him up, and we all have a little bit of time right now nowadays. Do yourself a favor, Google this article on vitamin D consumption, possibly boosting your immune system as little as 15 minutes of sunlight a day. It's from the former CDC director, Tom Frieden. We didn't get to it, but take the time to read it. It's a very interesting article. We'll see you next time on the Living a Longer and Healthier Life show.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.